All right, go ahead.
Good morning, everyone. Welcome to our presentation. It is titled Patient Partner Contributions to a Rapid Scoping Review on Communication During Disaster with Families of Children with Medical Complexity and Special Healthcare Needs. And I'd like to present our team. Next slide, please. And here are our faces in case you can't see them. So my name is Esther Lee. Then we have Megan Donaldson, Mike Scott, Neil Smith, Taiba Khan, and not with us today is Craig Mitten. Next slide, please. So for some background, children with medical complexity and special healthcare needs are living longer and thriving due to medical advances. These are children who, number one, need many specialist visits. Number two, rely on life-sustaining technology like feeding tubes. And number three, their families spend much time providing care for them. These children represent 1% of the pediatric population, but need at least 35% of pediatric health resources due to their healthcare needs. For example, specifically for children with medical complexity, we estimate that there are about 10,000 children in BC, and this number would be higher for children with special healthcare needs. Therefore, we need to improve the care for children with health complexity as they grow in number. Why did we choose to do this project? Before the pandemic, communication was a major challenge, especially in times of disasters like wildfires. The current pandemic has highlighted this need even further. There are many hurdles in smooth communication between healthcare professionals and families, and there's need for systems that help to reduce risk of harm in providing care for such groups. Next slide, please. So our question was to identify models of communication strategies used by health systems to communicate with families of children with special healthcare needs during times of disaster or crisis. Over to you, Neil.
Thank you very much, Esther. This presentation is about the role of our patient partners in the work, so it's not really about the findings, and so I'm going to just very rapidly breeze through methods and some of the key findings, and then if you are interested in that aspect of the project, we're more than happy to share additional information with you afterwards. Just get in touch with us. But anyway, as far as methods, this project is what's called a rapid scoping review. So it's really meant to look at what's been published and out there on a fairly broad or expansive research question, which is what Esther has given you. It's based on two literature searches, one that was done in 2020 and then which we updated and expanded in 2021. So ultimately we used 4 different databases of peer-reviewed literature, as well as looking at the gray literature on the internet and other kinds of non-peer-reviewed sources. In the end, we found that 26 papers that we included from those sources. 7 of them were specifically about the COVID pandemic, and 19 of them were looking at other kinds of disaster situations, such as hurricanes or earthquakes or things like that, from 9 different countries around the world, although none of the included papers were from the Canadian context. And as far as data extraction, we looked for what we call latent content, because very few of the papers that we found actually addressed communication explicitly. So we kind of looked at what they said implicitly about effective communication strategies. And we came up with 4 broad themes from the findings. So next slide, Megan. The 4 themes very quickly were the importance of collaborative planning before disasters. Everybody should be involved, families, healthcare professionals, other stakeholders, and importantly, the children themselves. Then secondly, during times of disaster, if it's imminent or actually in progress, the key role of proactive outreach on the part of the providers and lots of people suggested maybe a designated point person or a care coordinator could do that rather than waiting until patients are and their families are needing to contact you. Reach out first. Neighbors, peers are often the first contacts in a disaster, the third theme. So those are networks, social networks that can be built upon and used to leverage support. And the fourth and final theme is post-disaster, getting back to usual routines as soon as possible is really important. Addressing mental health issues for children with medical complexity and their families, reestablishing school, reestablishing other care processes like physiotherapy or whatever it is. And these can very often involve remote technologies, which we've seen a lot of during the recent pandemic, and really learning how to work with those where people have that kind of access, which is important to remember. Okay, back to you, Esther.
Thank you, Neil. Our study was funded by the Strategy for Patient-Oriented Research Evidence Alliance, specifically the COVID-19 evidence synthesis. Once we completed the rapid review, we sought patient partners, specifically caregivers of children with special healthcare needs who have lived experience. We wanted them to act as our advisors, co-thinkers, and listeners on our project. SPORE EA connected us with 2 patient partners, and we had virtual sessions as well as emails reviewing our results. I will now let our patient partners share their experiences. Over to you, Mike and Teva.
Hi there. Thank you very much, Esther. Yes, it's been a great opportunity to be involved in patient-oriented research over the last while here, and especially with this project. Some of the communications concerns overlap between the need for better communications for disaster response and preparedness for children with complex medical needs, because also the patients in research are patients and have those extra challenges. So I ask in this quick slide here, how do we achieve the most effective patient-oriented research where the research, the public, and the patient partner benefit? The patient partner helps the research by providing expertise with input on a research topic that they're familiar with or that they can relate to. The research and the public benefit from the data and from the expansion on the research, and the patient partner is fairly compensated. That's how good patient-oriented research happens. Some of the keys I've found to this, there's 5 keys, is we agree on a partnership to begin with to help define communications and commitment expectations. So compensation and how do we contact, like is it email, phone, how many times are we allowed, or what time of the day is best, that type of thing. Then moving on into the how patients can use their natural expression. I think that's a key point, is that patient partners need to be able to express and share their information with somewhat of a natural condition for them, where we all know state-specific learning and memory is important in improving information that's provided and returning to the results of the research query. Also, we have the adequate time that's needed for sharing our research and our experience in the research from all sides of the team. So the patient partners need time to finish what they're saying in order to complete their contribution and not experience perhaps stigma from being left with an inaccurate view. And also the researchers need to be able to share their experience in the methodology and all the research expertise they have. And in the fourth summarizes that we all need to have some flexibility and better schedules for, or flexible schedules, and that helps this type of research. Finally, I say that the communications for the research are open to the patient partners through the course of the research and in debrief or other post-research summary, so that the patient partner is able to reach out at any time to help provide, and likewise the researcher is able to ask more questions to help enable better research. Thank you very much. Next slide.
Hi, this is Tayeba, and firstly, I would like to thank Spore Evidence Alliance for starting to include patients in these conversations, because one of the things as parents of these children we notice is that there is a lot of coordination issues when accessing different kinds of health services for these children. And as we already discussed, about 35% of the resources go towards the 1% of the children, and therefore having an efficient system would definitely benefit not only the families, the children, but also the healthcare system. So our hope is that our contribution in this project highlights some of the facets of these challenges, and by involving the healthcare authorities in this dialogue, we hope that we can create more streamlined systems. And some of the three most important things that I would recommend in this discussion is that whenever we are planning for disasters, it is important that healthcare providers understand the perspective of the patients as well as their caregivers, because these are very different lived experiences. And so they should try to live in the shoes of the family. And when you include these families, it may also provide you with some of the different ways the families innovate, how they improve upon their lives, how they creatively try to manage the chaos around them when they're taking care of their children. And then, of course, the costs associated with this complex care. These dialogues, I believe, are going to help create a streamlined version which will allocate monies efficiently and effectively. Thank you. Next slide.
Thank you so much, Mike and Teba. So in summary, from our project, we know that we need proactive and preventative planning for disasters that involves the families and children. We need also support for families and health professionals to do this, as our current healthcare model is mainly reactive and for acute care. And we need to support families holistically after the disaster, for example, the pandemic. And we all know that services on mental health and wellness can be improved. Some of the strengths of our project is that we were able to expand on the results from a previous Landmark article, and that we hope our project will spur more research and improvement in this field. We were also able to identify unique perspectives of families and their insights. Some reflections that I have personally, I'm still learning on patient-oriented research, and I wondered if our results would have changed if we had involved our patient partners from the beginning of our project. And I've heard back from our patient partners, they wondered the same as well. And I think the key learning point from me is that it's really important that any improvement projects that is around our families need to involve them from the get-go. And we need more support systems so that their time can be valued and compensated accordingly. Next slide, please. So thank you so much for listening. We would like to acknowledge Spore EA, as well as Pamela Harrison and Mimi Doyle-Waters, the Health Information Specialist at BC Children's Hospital, and C2E2. The findings will be published on the Spore Evidence Alliance website. And for more information, please feel free to contact me by email. And we now welcome questions from the audience. Thank you so much.